Hello and welcome to Lynchburg Live. I'm your host, Linda Smith. Behind us is an operating room, just for those of you who are wondering what that is. In 2007, the motion picture Awake, featuring a storyline about a young man undergoing heart surgery, was released. He was aware of the entire procedure, surgical procedure, and was not able to tell any of the doctors in the film what was happening to him, which was anesthesia awareness. On February 4th of this year, the popular television series Grey's Anatomy featured a storyline that also included anesthesia awareness. Prior to the episodes being aired, the president of the American Society of Anesthesiologists contacted the program's executive producer, Shonda Rhimes, and alerted her to the possibility that this kind of dramatization had the potential to alarm and possibly induce viewers to avoid needed and sometimes life-saving surgery. My guest tonight is Dr. Tom Delaney. Dr. Delaney is a Lynchburg anesthesiologist, and he's going to be discussing with me anesthesia awareness. Dr. Delaney, I'm delighted to have you as my guest.
It's wonderful to be here.
Please tell our audience as we get started what the difference is between an anesthesiologist and any other type of physician.
We're better.
How did I know you were going to say that?
No. An anesthesiologist is a physician, that means finished medical school, who then does usually a 4-year residency and sometimes an additional fellowship year in anesthesiology, and then is certified to deliver surgical anesthesia, similar to other specialties who do similar lengths of time to get trained in their own specialties.
So you are just primarily always in the operating room putting people to sleep.
And hopefully waking them up too.
All right, tell us, what is anesthesia awareness?
Anesthesia awareness is, what we really mean by anesthesia awareness is unintended intraoperative awareness. And there's a sidelight to that. Not only do we want to talk about awareness, but what we really are concerned about is recall. Awareness means that we're awake and conscious of what's happening, but what really concerns us with this topic is, does the patient recall what happened at the time? So there are two issues really, awareness and recall.
Just sort of generally, what do the patients experience who say they've had this happen to them?
It can be anything from full and total wide awake awareness, which obviously is awful, and we hate to find out that that's happened, and it is very, very, very unusual. But in which case the patient would be totally awake and aware of everything that's happening, may or may not be able to move. That's at one end of the spectrum. At the other end of the spectrum would be some kind of vague awareness that something is happening. You might hear voices, you might feel pressure. There might be other sensations. So we have everything from that very minimal awareness all the way to full, wide awake, complete awareness with all senses involved. And luckily that really is extremely rare.
Right. Right,
and hopefully getting rarer.
There's general anesthesia and there's conscious sedation. What's the difference between those two types of anesthesia?
Okay, general anesthesia, as you probably can intuit from the name, involves the patient being totally anesthetized, totally unconscious. Usually what we use general anesthesia for is for major surgical procedures. We also often will use what's called conscious sedation or monitored anesthesia care with sedation. And this is generally for more minor surgical procedures such as colonoscopy or carpal tunnel surgery. And in this situation, a general anesthetic is really not necessary or required, but the patient and often the physicians involved would prefer that the patient be comfortable and relaxed, using drugs to attain that state.
Does anesthesia awareness occur in both? Or is it primarily general anesthesia?
Anesthesia awareness and recall is unusual in general anesthesia, but it does happen. Awareness and recall is quite common in monitored care. So if you have, for example, a carpal tunnel operation on your hand and you are sedated to make you more comfortable and relaxed, it is very likely that you are going to have awareness and recall. We can gauge, with the amount of medication that we use, we can make people more or less sedated. The more sedated you are, the less likely you are to remember. But with monitored anesthesia care and conscious sedation, we don't have as a goal lack of awareness. There is almost always some awareness and usually some recall too.
Like spinal anesthetics?
Another type of anesthetic.
That's sort of like monitored anesthesia.
Spinal anesthetic is a regional anesthetic, which means that part of the body is numbed and numbed completely so that there is absolutely no sensation. So for example, if a patient is having a knee scope or a knee replacement, we often will do a spinal anesthetic. So the patient is totally numb from the waist down, and then in addition to that, we also will sedate the patient to make them comfortable to reduce the level of anxiety. And often with that, they'll drift in and out of a light sleep. But there will be, in that situation, there will be some awareness almost always. Patients will be aware of hearing voices, being aware of their surroundings. Almost always it's a very pleasant awareness. Once we take away the anxiety, the patients are comfortable and don't mind having some awareness.
Right. What procedures require a general anesthetic? Just sort of an overview.
Well, most common major surgical procedures would require a general anesthetic. Heart surgery, for sure, any operation on the chest. Most operations in the abdomen, especially the upper abdomen, such as gallbladder surgery, stomach surgery, neurosurgery on the head, on the brain, requires general anesthesia.
Right.
When we get to the lower part of the body, then we can start offering spinal or epidural anesthesia. So for example, if you need to have a hernia done, or a knee scope, or ankle or foot surgery, when we get below the waist, we can often talk about doing a regional anesthetic. And at that point, a general anesthetic is an option, but not an absolute necessity.
Getting back to actual anesthesia awareness, what's the frequency of this occurring?
Luckily, it's not frequent. Most estimates now are in the range of 1 in 1,000 patients having a general anesthetic has an unintended awareness and recall. On the one hand, that doesn't sound like many. On the other hand, when you consider that in this country there are 20 million operations, general anesthesia cases every year, that works out to something like 20,000 awareness cases per year, which works out to something like 100 a day. So it is unusual, but given the numbers, it does happen obviously more than we'd like. Now, there are certain situations that are more likely to be, where the patient is more likely to have awareness, and I guess we can get into that more later, but for your typical elective general anesthetic, the likelihood of having awareness is probably more like 1 in 10,000. The cases that are more likely to have anesthesia awareness are the ones where light anesthesia is involved. For example, if a patient has a car accident, has major bleeding, comes into the emergency room with very low blood pressure and is unstable but needs an emergency operation of some kind, in that case, we are not able to give what we would consider a full general anesthetic. We just do a light anesthetic because anything more than that would be harmful to the patient, and the patient might not survive the operation itself. So